We're very fortunate to have Sarah Ivanhoe here. She's quite a remarkable person. She's a yoga spokesperson for Weight Watchers, most recently releasing the Weight Watchers Yoga Starter Kit. She began teaching in 1995, shortly after graduating with honors from New York University. She has completed the Yoga Works teacher training. It's a specialized therapeutics program. It's yoga therapy, not just yoga, but yoga therapy, and is also certified by Eric Schiffman in his freestyle form. Freeform style. I've heard of it, but I can't pronounce it. Sarah is the instructor for the Yoga for Dummies series. That includes me and most other people, I think. The Crunch Yoga series, as well as a collaboration with Russell Simmons on Yoga Live. She had an extended run on Fit TV with All Stars Workout and on Exercise TV with Yoga on the Edge. She has been highlighted in the acclaimed documentary Titans of Yoga, a great documentary, and Women of Bhakti. Sarah is one of the few teachers certified by the Green Yoga Association to teach yoga and ecology. Tomorrow we will have a presentation on yoga and ecology in relation to integrative medicine by Birka Burnison. So this is wonderful that she has this certification. It's very rare. In addition, Loyola Marymount University has awarded Sarah Ivanhoe a certificate in yoga philosophy. She is currently getting her master's degree at Loyola Marymount University in the inaugural yoga philosophy program and serves as a student senator of Bellarmine College. Please welcome Sarah Ivanhoe.
After hearing that list, it does sound like I would have a sleep disorder, doesn't it? Like with all those things. I must have been an insomniac to be doing all of that. Thank you guys so much for coming here. I know there's so much that you could have been doing on a Saturday. Those of you who are being forced to be here because you are RITA students, thank you so much for your patience and open hearts and sense of humor. Before I start talking about sleep this afternoon, I just wanted to take a moment to, is there anyone here who hasn't met Rita, the wonderful woman who just introduced me? So Rita has been working tirelessly for months to put this weekend together, and it may not seem like a big deal. You're kind of going from class to class, and whatever, it seems like a drag. But to be able to wrangle all of us speakers is a huge job. We all have lots of demands. Getting everybody scheduled, it is a really huge, tremendous job. And I just wanted to, let's see here. Give her a little official gift, a little thank you for putting this all together. Thank you, Rita Sherman. Goddess. Okay, let's see here. Where's the clicker? Okay. Let's see. I'm new to these clickers. Ah, okay, there it is. Okay, so like Rita said, did everybody have lots of sugar and caffeine and stimulants at lunch so you guys can stay awake for the presentation? So who here has ever had trouble sleeping? Right. Okay, and those of you who did not raise your hand, you've had everybody else is now raising their hand. Okay, you know somebody who's had trouble sleeping? Or some mothers in the audience who actually didn't have any trouble sleeping, but your child kept waking you up so that you weren't able to get a sustained night's sleep. Or some of us, even something simple as long bits of travel where sleep would be interrupted. And we all know that when we don't get a full good night's sleep, we are not all of ourselves, right? So what happens when we don't have a good night's sleep? We, tiredness, yeah? Somebody else? Cranky, that was the one I was going to say. I get so cranky. Right, loss of energy? Loss of memory, thank you, yeah. Anyone else? Yes, so I think Rita's been working for a long time. She's totally sleep deprived. Exactly, trouble communicating, it's hard to get stuff out of your mouth. Exactly. So all of these things we know. When we don't get a good night's sleep, how much, are you guys hearing me okay, by the way? Not too loud? The worst is too loud. Okay, let me know. It's interactive, it's democracy in here. So we all know that when we don't get a good night's sleep, we aren't all of ourselves. And the fact that each one of you are even here at a university on an afternoon, that you got yourself into an auditorium to learn something, means that you're basically a driven person. Like if you weren't, you'd be home watching football or playing a video game or something like this. So everybody here obviously has enough drive where we have passions and we're wanting to get things done. And we know that not having sufficient sleep impedes us from that, and it gives us all sorts of liabilities. It makes us not as efficient in our workplace. Those of us who are students, I'm a grad student, and trying to memorize my Sanskrit paradigms are just it's very difficult to have any memory, focus. I know when I don't get a good night's sleep, mostly it's my boyfriend who suffers, has to deal with me as cranky. So we pretty much all know. I wanted to at least at first just get us all on the same page of what we all know is the issue, right? I need to see some nods. Yeah, okay, excellent. All right. The other thing that I think is important, and I'm going to kind of go through a couple of different distinct points, but actually I'm just going to jump right in here. Let's see. So we're on the same page. A sleep disorder, this is, to me, how it feels when you're not sleeping, completely upside down with ships sailing through your head. Just so that we're on the same page, insomnia, sleep disorders, can include trouble falling asleep. It also includes difficulty staying asleep. It also includes sleep apnea. You guys know what sleep apnea is? Right, so it's basically, they originally find it by the sleep apnea here. They originally diagnose it by somebody who has excessive snoring and basically find that there is an impediment to the breathing. And because the breathing starts to actually get stopped during sleep, people then stop breathing and then end up waking up, and therefore can't really reach a deep sleep cycle because of this impediment. And a lot of people don't even know that they have this until much later in life. So if you know anybody who's showing signs of something like that, basically you go to a sleep lab, you have somebody check you out, and there's actually some really wonderful treatments for that. Sleep disorder also can include walking and talking within one's sleep. So all of these things are, when we talk about sleep disorder, they can include all of these things, but they are not limited to all of these things. So if there are other problems with sleeping that you know of, those can also be included here, okay? Let's see. I love this clicker. Okay. Just a couple of facts and figures so that we have it. We've really found out that sleep disorder is a mass epidemic. It's affecting so many people. 50 to 70 million Americans suffer with sleep disorder. It's a lot. There are billions of dollars that are spent on both over-the-counter and prescription sleep medications. This also includes alternative medicine, but so much money, so many resources that are turned towards this problem. This is one thing I found crazy. 100,000 motor vehicle accidents per year that basically can be traced back to somebody saying, oh, I didn't have a good night's sleep the night before. And 500 motor vehicle deaths. Somebody falling asleep at the wheel, right? Okay, how's that? So I wanted to just get us a little bit of on page of what the problem is, what sleep disorder constitutes of, and who it is suffers from it. Insomnia and sleep disorders, to be really clear, we're talking, we're here this weekend talking about different ailments, we're talking about mindfulness, we're talking about treatments and cures. There is no cure for insomnia. It is a disease with no cure, hence the title of the talk. We have treatments that help to lessen the symptoms of it, but there is no cure for the disease. Which is why I think so many resources are being thrown to it, because nothing really completely works. So just to kind of digress and go off on a little bit of a tangent, this topic is close to my heart because I actually suffered from insomnia as an infant, which is really rare. In fact, my mother says that when she was pregnant with me, I had insomnia even in utero. She had my brother is before me, and he's a Buddhist and was, I guess, just having, meditating while in the room all the time. And then I just made up for lost time. She just said I was just kick, and was just throughout her whole pregnancy saying, this baby will not sleep. My first memories were living on the Stanford campus when I grew up. My father was a professor there at the time. And my first memories of, most of us memory about 3 or 4 years old are the first memory, something like that. Of me being in bed, awake, all night, with the lights off, and waiting to be woken up by one of my parents in the morning. I, of course, just thought this was a normal thing to do. As your child, I just kind of didn't know the difference, and my parents just somehow weren't aware of it. But I actually suffered from this very severe insomnia as a child, and I would go definitely at a full night with no sleep. Sometimes I sometimes I went up to 2, 3, and there was more than one time where I actually went 4 nights in a row with no sleep at all. This is, of course, what they do to prisoners, when they're torturing them. This is like the worst, having that much sleep deprivation gives you hallucinations and, makes you have all sorts of sort of crazy emotional things go on. So it's something that I grew up with. Now, most insomnia doesn't start at a young age. Most insomnia is either set on by a trauma, like there was some sort of trauma experienced, or some sort of stress that comes on, usually they say at around high school time, when students start to really feel stress and experience the stress of getting something done. So stress or trauma is one of usually the 2 main triggers for insomnia. But there is what they would call an inherited or some sort of genetic condition, which is what I have, being that I'm sort of born with it. And whether the insomnia that is set on by either stress or trauma, those cases of insomnia are much more easily treated with some of the treatments we have. What I happen to have is insomnia, that I was born with. It's almost like trying to cure a learning disability. There just isn't going to be a cure with it. It's just how I was made. So for me, I got very, very interested at an early age to try to find some treatments to give myself some sort of relief. You guys with me so far on this? Okay, great. There's nothing like stimulus. That's your own suffering, as they say, right? So this is just me upside down as a kid. Okay, so I started to just get interested in some basic things. What can I do? And this is some basic stuff that I'm sure that you've all heard, but I wanted to go over just briefly. And I learned some very basic tools if you're having trouble sleeping, a couple of just classic do's and don'ts. One of them is to really regulate your sleep and wake time, meaning if it's very erratic, it's more difficult to do it. If you start to come up with a rhythm, it's easier. Personally, having insomnia, I found that to be very difficult. Sometimes I wouldn't fall asleep till 6 in the morning, then I'm not going to regulate my wake time and have it be 7:30, something like that. So I found that, this tip, which was given to me by the doctors, it may be very helpful for some, not helpful for me. Avoid large meals before bedtime. I actually found that very helpful. But some people find actually that eating a lot helps put them to sleep. So there's, like I said, this is not these are treatments that are not an exact science. If they worked perfectly, then everybody would be doing them. Although this is really a classic, avoiding sugar, caffeine, alcohol, and nicotine, all which are stimulants that kind of give us a peak of energy, especially right after lunch when we're full and we're tired and we're listening to a lecture. It's to nod off, a cup of coffee, candy bar, something like this. I won't judge anybody for smoking, but all of these things give us a boost, especially when we've had nights of no sleep. My God, I don't care. I would take anything, just to be awake for a little bit. But it does perpetuate the cycle. This is the one that's the most important now, which I think even 20, 30 years ago was not as important. They say that these little blue lights that are shining in front of your eyes, hey, everyone who's on a laptop, there we go. There's everyone. Okay, so everyone who's on a laptop or looking at your phones, you guys know that this is a special kind of light, right? It's a specific type. And apparently the makeup of that light triggers the wakefulness spot in your brain. So specifically, lights from computers, lights from phones, and lights from television, those are supposed to be the big no-nos. About an hour or 2 hours before sleep. If you feel like, oh, I can't sleep, I'm agitated, the worst thing to do is pick up your phone and start Instagramming type of thing. Okay, it does. The other thing is that we have adapted to quickening our senses, and in so many ways it has been so beneficial. Right? It's allowed us to multitask and create all these different things, but it also does really agitate the brain. So one of the main things is learning to kind of pull away from that. Technology deprivation, like I was just talking about, and let's read a slightly boring book towards right when you're falling asleep. So that's when I pull out my Sanskrit dictionary. The main thing is you don't want to be getting to, don't read anything that's really going to be exciting that you want to get to the next page to, because of course then it keeps you awake, which is not the point. It's all pretty simple, right? Okay. So this is just some of the work that I've done. So you sort of pick up. So I had this extreme difficulty sleeping as a child. I sort of learned some do's and don'ts of sleep, and those didn't help me at all. I tried all sorts of acupuncture and homeopathy, and I tried all sorts of stuff. Didn't help me at all. So at a very young age, I was encouraged to try yoga and meditation. In many ways, I feel lucky that I had a problem that steered me onto this path at such a young age. I did my first, what we're going to do together, yoga nidra practice when I was 9 years old, as a way that the doctors were hoping to help get me to sleep. And I started doing physical yoga at 14. I found that both yoga and meditation were not cures for my disease. And it's important to say that and not to make a claim that isn't 100% accurate. But what I did find along the way was an incredible practice that was able to alleviate symptoms, alleviate stress, and some of my discomfort along the way. Along the way, I got to do some amazing projects that involved yoga and meditation, that allowed me to spread these practices to people all over the world. So Yoga for Dummies is translated into something like 6 languages. Weight Watchers these have all sold millions of copies. And what's to me cool about that is that I get emails from somebody in Scandinavia. I get an email from somebody in Kansas. I get emails from people on social media from people all over the world who never would have been interested in any kind of mindfulness, yoga, and meditation. And somehow one of these, corporate branded things they were open to. So Weight Watchers, and everyone in their town did Weight Watchers. And so they put it in, and I make them breathe. I make them close their eyes. I get it in. And even though they started with this sort of very simple, lose weight type of goal, the sort of fun part of it was they almost always leave with a benefit that they did not expect. They end up leaving with an experience of stillness and of yoga that they didn't know that they would get. It's been really rewarding for me. In addition, because I've done a lot of this work on sleep, I just wanted to show you this. So I've done extensive writing articles and videos about yoga and sleep and some of the techniques I've done that I've found helpful. So because of stuff like this, I do get a lot of people reaching out with similar problems constantly. Oh, my son can't sleep. What can I do? You know, oh, my mom can't sleep. What should I do? I haven't been able to sleep for 2 nights. What can I do? And it's allowed me to connect with others who are suffering from the same problem. Now, the funny thing about insomnia is that it is a disease that you basically suffer from alone. People can say they support you, but when it's 11 o'clock at night, they all go to bed. And you are by yourself, like twiddling your thumbs. It's incredibly lonely, and it's incredibly isolating. Alcoholics, that's a disease with no treatment, a disease with no cure. They have meetings where they go and they support each other. Insomnia, we don't have a structure set up like that. And the disease we suffer from, it's not like people go and visit you in the hospital. They can't see your arm is broken, right? It's not a visible disease. They just go like, why are you so cranky today? Type of thing, you know? So it's one of the things that's been extraordinary about all of this is that it has, at least for me, allowed me to connect with others and to kind of try to create some support and connection for those of us who struggle with it. The meaning of yoga is union, to feel connected. And when you have insomnia, you feel absolutely alone and cut off. You feel completely separate. Everybody else is able to do something normal, and you can't do it. And it just feeds on itself. So very, very briefly, as I started to investigate further, most of us have seen something like this before. This is the stages of sleep. And those of you, I know there's a couple of, medical doctors here, so you could argue with exactly how this goes. This may not be perfect. I don't want to make a real, there's a lot of debate in all of this. But basically, as one starts to fall asleep, you go into like a sort of a deep relaxed state. Your heart rate slows down, but you're not quite there yet. This is stages 1 and 2. Stages 3 and 4, deep sleep, body is still rhythmic. The brain starts to shift into a different area, and you start to go down, and stage 5 is where you're in rapid eye movement. The brain waves speed up. This is where you dream, and this is where they say like the real healing of your system occurs. This is where everything starts to get repaired. Most of us know that when we go to sleep at night, the cycle goes around and around throughout the evening, throughout your sleep. So it's not like you start here at 10 o'clock and you're here at 6 a.m. when the alarm goes off. It goes around and around throughout the night. Many of us who have, at least for me, I very easily go stages 1, 2, and sort of maybe right into here. And for me personally, my insomnia would then, it's almost like a record skipping. I skip right back to the beginning, and I just go like that. So just, that's often one of the ways that a sleep disorder manifests itself. So as I started to investigate more through Western medicine, about the way sleep cycle works, and as my path of yoga, as I walked down the path of yoga, I just thought it was so interesting that I found this is what they call the yogic stages of consciousness, and that there was, not exact, but a similar structure. This, of course, is thousands of years old from the yogis, and it's always so fun when there's a yoga concept. And, they've only been able to study sleep in Western medicine the last maybe 40, 50 years. So it's wonderful when Western medicine, validates what the yogis have been saying for such a long time. But the yogis basically say essentially this. There's a state where we're awaking. There's a state where we then go into dreaming. Beneath that is a dreamless sleep. And beneath that is what they call turiya, which is... please excuse me if I don't explain this correctly, but it's almost like nothingness. There's lots of these stages of consciousness. This is actually a beautiful way that we find the sacred syllable Om. This is the A, the U, the M, and the silence after the sound. But most interesting to me with this, since I knew that I was not able to get into these dreaming states, I wasn't able to get into a typical REM state. What I did learn through this practice that we'll do in a moment is that the real healing happens even deeper than a dreaming. So any of you in the sleep disorders, any of you have any experience with like grinding your teeth at night, right? Some of us kicking our legs, right? Okay, so yeah, so it's a fascinating thing that even within sleep, how much tension can be in the body, right? Like you can be checked out, but still have tension happening. So this practice of Yoga Nidra that we're going to do next, there we go. Practice of Yoga Nidra that we're going to take just a couple moments to do. The idea is that if we can learn to calm our bodies, to quiet our minds, that we can actually find ourselves in a state that is completely awake and totally relaxed. Originally, this practice was meant as a form of meditation. You were never meant to sleep. It was taught to me because very often when learning these stages, it does help somebody with sleep trouble to sleep. But what I mostly found was that even if doing a guided relaxation didn't help me sleep, even if I was in such bad shape that this wonderful practice couldn't help me to do what I thought was the goal, what it gave me was something so much better than the goal. It taught me that even if I couldn't get a good night's sleep, since there is no cure, we do have this wonderful treatment. And that getting good at this Yoga Nidra practice can leave one feeling energized and healed even without a good night's sleep. So at least there's something. Okay? Is that kind of clear? Okay. You guys game for 5 minutes? A couple minutes? Okay. So maybe we could, maybe we should drop some of the lights. Oh, we can't. Oh, we can't. Okay, well then you're just going to be dropping your own lights by taking your 2 eyelids and bringing them together. So please put your computers down, put your pads down, put the coffee stimulants down. If you're holding onto your glasses or your a pen or a tissue, something like this. I dare you, drop all of it. Put it all down on the ground, onto the seat next to you. And let yourself get into a very comfortable position. You can fold your hands, you can cross your arms, you can cross your feet. You actually just do it however you like. But I'm going to ask that you find a position where you can then stop moving. It's unbelievable how hard that is, just to find a position and stop moving. Now, the moment you close your eyes and stop moving, you can immediately become much more aware of what's actually happening around you. Any movement that happens with anybody else in the room, you can feel acutely. Now, with your eyes closed, just take a couple of easy breaths. Everything you've been trying to get done, everything you've been trying to figure out, I'm going to ask that you decide to drop it for the next few minutes. I promise you it'll be okay. Just drop it. Please bring your attention to the feeling of the air coming in and out of your nose. Gently feel breath come in. Feel the breath go out. Don't try to change the pattern. Don't try to fix it. And with your eyes closed, see if it's possible to get a mental picture of the shape that your body is making. Using your mind's eye, we could call it the yogic eye, the eye that sees, get a mental picture of the shape of you. Notice that that shape rises up and expands on the inhale, and that shape softens and relaxes on the exhale. Watch it rise and relax. Rise and relax. Now with your mind's eye, begin to trace the line that separates you from the room around you. There is a line, a boundary that makes up you. Includes your clothes and your hair, your jewelry. Mentally trace that line. If you're wearing a hat or something in your head, includes that. And now please turn your attention and trace the line. Trace the line of the space of the room around you. The room around you is making its own shape. Trace the line of that shape. There is a line that separates you from the room around you. Begin to blur that line. That line moves with your breath. It rises and relaxes. That moving line becomes so fuzzy that you're not so sure where your body ends and the world around you begins. Things become so out of focus. You're not sure where you end and the room begins. begin to blur into the room around you. Become the room around you. You are the room around you. And then please become aware that you are in a room filled with other yogis who are also dissolving their boundaries and becoming one with the world around them. Breathing the same air. And one of the many definitions of yoga is union. So for the last moment or two, everyone's dissolving the boundary that separates them from the room around them and feeling a sense of oneness. And then please bring the palms together at your heart in just a gesture of gratitude, a gesture of offering. Knowing that you had just the perfect experience today, that you learned exactly what you were meant to learn, that you relaxed in just the way you were meant to relax, and that on your journey you are right where you're supposed to be. Thank you so much. Namaste. I've got a couple minutes if we want to do just a few little questions. Yes. Hi. Thank you. And your name? Yes, I do sometimes, but that was the trouble. Yeah. Like a broken record. Yeah, really challenging. It's not that it never would, but the problem was it wouldn't break through in the normal way it was supposed to, sometimes for days. Yeah. Thanks for understanding. Yes. A little louder, I'm sorry.
How did it help that insomnia?
Yeah. I'd say almost all people who learn this technique of Yoga Nidra combined with sleep hygiene, just kind of proper self-care, and then also the support of alternative medicine. Those who really do all those practices, 90% of people, their insomnia goes away. For me personally, it wasn't enough. So what it is able to do is on nights where I still have insomnia, or I'm still not able to sleep, I'll do this probably usually in the afternoon when it starts to really hit, and I'll at least get a sense of feeling refreshed from it. So it would be really easy for me to kind of just get up and say to you, hey, this is the solution, just do this and you'll be fine. And I wish it were that easy, but it is for many people, but it wasn't for me. Anything on that? Does that make sense? Anything else you'd like to add? I can see your rate like it's about to come out.
I actually have been the same, but I've had similar results
Yeah.
from tremendous people that at the end of the day, they have not received the kind of results. And it works, but it doesn't work.
Right. And I think,
Still curious to find the final.
right. And let's all keep trying, you know. But I think it is important for us to keep in mind that the practice itself was not created for people who couldn't sleep. It was originally created to give an experience of the turiya, the experience of nothingness beyond sleep. And we have adapted it as a useful tool. And so therefore I feel like I can't fault it for not giving me exactly what I wanted. But let's keep looking, and I'd love to stay in communication about it.
There are people who have, according to Ayurveda, people with high blood pressure,
Yes, that's, yeah, it's me.
they actually get a lot of help.
I have, yeah, yeah,
But for insomniacs like yourself,
yeah. But I've learned, but Ayurveda has been enormously helpful. I've been working with it for a good 15 years. Vata, right here. Okay, yes.
have you tried sleeping pills or noiseless noise or
Yes, everything. Yeah, I've tried it all. I've tried it all. And some of it works and some of it doesn't. Some sleeping pills really work and some sleeping pills don't. My father's a neuroradiologist, so he's been really pushing me on Western medicine, and I actually find a lot of it has been very helpful. I was really resistant to it up until recently, and now I found that all of the side effects that I was resistant to, I'd much rather have those than a sleepless night. So yeah, well, as you can see, I've been into intense exercise from a very young age. As a competitive butterflyer, and I've been teaching yoga now. Next year is 20 years. I think it's incredibly important. Whether it cures the sleeplessness or not, no one could ever argue that intense exercise is important for all of us to do. I find it really helpful for my mood and my state of mind. But there was a period of my life where I would exercise very hard, and it wouldn't always guarantee a night's sleep, but I do sleep with earplugs every night. I find that important. But the light doesn't affect me. Some people, noise doesn't affect them, and light affects them. It's the human brain is so complex. Yeah. Yes. Yeah, well, there is that specific method. There are many different methods. I'm kind of limited on my time, and it's also, I find, a little difficult to do if people are sitting. It's difficult to do, with a very mixed audience. So for me, my plan of what I wanted to do here was to do something just very immediately tactile to try to grab the focus. For people who might not be used to being able to focus easily, usually starting either at the thumb or the toe or something like this and going through bit by bit. Yeah, oh yeah, absolutely. But it's a different group, and what's important, at least what I was hoping to do here, was quickly grabbing people's attention to something very easily tangible so that they could shift where their headspace was at. But yes, thank you. Yes.
differentiate what is there from being able to say that if somebody has a stress or a trauma and then they lose the sleep during the night versus having the really something. Maybe the stress goes away, let's say periodically, 6 months, a year, or a trauma, if that the trauma goes down. Does it go back or does it is that related to sleep deprivation versus
Yeah, that's a great question. I'm running out of time, right? It's a great question, and I think it'd be better. I feel like that's really more of a question for a doctor and for somebody who's really got actual, I think it'd be better for somebody like that. But my experience is both. Some people are able to swing back from it. Some people have periods of, I believe it's all over the map, which is why the problem is so vast. Yeah, I'm out of time, yeah? I don't want to be disrespectful. We've got a bunch of hands, but if we're out on time, then I don't want to be disrespectful. Oh, okay, yes.
Have you found when practicing yoga and meditation, your insomnia has impeded you or constricted you from certain energy levels or kind of unifying the body?
Yeah, actually, it's interesting. I have one friend who I considered sort of somebody who had been on the path for a long time. He's a sort of a famous kirtan artist. Maybe some of you have heard of Krishna Das. Has anyone heard of Krishna Das? So he's been a very close friend of mine for probably about 17 or 18 years. And I would always sort of consult with him, what should I do? What should I do? Should I chant this? Should I do? I always wanted him to kind of tell me what to do. And it was so interesting because I expected him to give me these long, detailed practices to do. And he said to me, he goes, no practice that you do is going to do anything for you until you get your sleep figured out. He said, if it's like trying to teach a hungry man about spirituality. Like if you have something that's really a real obstacle, it's hard to even do that much. So for me, it was more important that I had those practices to relieve pain and suffering that I was having from insomnia. But it was much more difficult to do those practices. Those of us that had sleepless nights, it feels like your skin has been sanded off with sandpaper. It's to try to do asana or to sit still in meditation. I mean, it's absolutely agonizing. So it's, it was all that more important, but it was difficult. Yeah. Okay, so I'll be here. I'll just kind of hang out in the back a little bit. If you guys want to ask more questions and talk, I really would love to do this because it's important that we have an exchange about it. But I want to honor the timeline here. So thank you guys so much for being open and just kind of jumping in and going for the new routine. Thank you so much.
Once again, I congratulate you for organizing this beautiful conference and bringing the youngsters to this conference. My dear brothers and sisters, I bring greetings to all of you from Bangalore, the Silicon City of India. That's where our university is set, and we have our nice campus called Prashanti Kutiram and Abode of Peace. I've been asked to talk about the yoga therapy, evidence-based yoga therapy for metabolic disorders. What is this that we call it as metabolic syndrome, which has become very prevalent, As you could see, I've taken it from Wikipedia, as most people know about the definition. It's a syndrome, is the name for a group of risk factors that raises your risk for heart disease, diabetes, stroke, etc. Here, metabolic refers to the biochemical process involved in the body's normal functioning. And heart disease refers to coronary heart diseases called SCHD, and it may lead to death even and strokes and so on. So the prevalence of CHD, particularly diabetes, has been rising. 7% of the people in the US has CHD and 8.3 diabetic. Spread all over, you could see. USA is top third in the world after China and India. China is number one, India is second, and third is United States. And not to talk about the big spending that the countries have to make, the direct cost. What is the solution? Modern medical system has had great achievements, and in the last century it was so famous that contagious diseases and very sophisticated surgeries. Now today about 5,000 types of surgeries are available. You can replace every part of the body. And all these things have been happening. Therefore, people are very enthused. I remember in the 1960s that we are bringing health for all by 2000. That was a big slogan that the WHO announced. But as we reach the end of the last century, then we faced a new challenge. That's pandemics of the new era. And that is where we have the metabolic syndromes, the ischemic heart disease, coronary artery diseases, diabetes, asthma, hypertension, IBS, cancer, anxiety, depression, insomnia and whatnot. Now they are all called as NCDs, non-communicable diseases. And unfortunately, no solutions to this. Once you have diabetes, for your life. Once you have heart problems, your days have to be counted. If you have cancer, your days are numbered. Why? You have been able to achieve such great things in modern science and technology. Why? Because I consider the basic reason for that is our knowledge base. The knowledge that we have today in the modern medical system, which is based on modern science, is limited to the physical world around us. What do I mean? Today, we understand that every object is made out of molecules, atoms, protons, neutrons, electrons, fundamental particles. And what are they made of? Small particles, what are they made of? Energy packets. Packets of energy called quarks. So everything is nothing but energy. E equals mc squared. You can calculate how much of energy is in given mass. For example, if I convert this into energy, it can burn up the whole of this Los Angeles itself. Such an immense energy packed into so-called inert matter. Then we also understood the laws that govern them. Newton's laws of motion, which you all have studied. Then when you go to extremely high speeds and very small particles, electrons filling around the nucleus, then the Newtonian mechanics will not hold. You have to go to higher laws, more generalized laws. They are called quantum mechanics, then theory of relativity. In a sense, we have understood everything about the physical world. Putting man on the moon, building skyscrapers, underwater tunnels, everything. And based on that, we were so enthused that we can solve all problems. And we thought there is nothing like mind, emotions, intellect, consciousness and so on, because everything is nothing but offshoot of matter. It's called upward causation. Everything is basically atoms, molecules. What are emotions? Special centers in the brain are the ones which bring about emotions. And what is the logical brain? Left lobe of the brain. And so on and so forth. This was the mindset that we had in late 60s and 70s. But gradually, we started changing. It was because of this wonderful book which came up, Prince of Capra, famous quantum physicist. And he wrote that book, I remember 1980-83, and it sold millions all over the world. All youngsters should read this book. Very beautiful book, very nicely written, in which he traced the entire history from the time of Newton and Descartes, how the science goes step by step, little by little, little by little, and we have reached this present stage. Then he says, the next steps is to understand things which are beyond the physical. Is there something like life, what we call as prana, which is independent of matter? What is it that we call as mind? Is it just function of the brain cells, or is it something different? What is the difference between mind, intellect and emotions? Can they exist without this physical body? Or is this physical body a must? And that consciousness, layers and layers of consciousness. No? So this is where science is slowly progressing. Since he wrote that book in 1983, almost 35 years, hardly we have progressed one step. We have started using the word consciousness and hardly we have clarity and depth of understanding about consciousness. That's where we stand today. Therefore, our knowledge base related to the subtle dimensions of this universe has been very, very meager. We are in a very embryonic stage. And therefore, any challenge that is related to these subtle dimensions of our creation, prana, mana, buddhi, chitta, ahankara, chaitanya, we have no solution. And metabolic syndrome and all these modern NSAIDs belong to this category. Because they are all very sophisticated, complicated challenges that we face. They are multidimensional. Not only a physical trauma can cause problems, but the mental restlessness, emotional upsurges, deep-rooted psychological conflicts, all are at the base of these problems. And therefore, we have no solution. Because our solution is one-dimensional, and these are multi-dimensional. What is the way out? It's here that India offers a solution. Because in India we have a complete knowledge base, and that was translated into action through the medical system called Ayush. Ayush is the acronym of A is Ayurveda, Y is Yoga, Naturopathy, Unani, Siddha, Homeopathy. The 6 systems of medicine developed in India. Use that thing. And what is the main difference in understanding between the Ayush system and the modern medical system? The Ayush system is based on what we call consciousness-based approach. It's a downward causation. In India, our people had realized that consciousness is primary. From there comes the other layers, grosser and grosser layers, come to the subtle thing and the gross physical thing. Matter is the end point. So this is called as the consciousness-based approach. Dr. Goswami, in a beautiful book, writes that it is a downward causation. And therefore yoga and Ayush system is based on a multidimensional, lifestyle-based approach. That's the main difference. And what does it say? According to yoga, it is said that the original state from where this whole creation has come is pure consciousness. And what's its feature? It's unchanging dimension of our entire existence. As already pointed out by our friend in his earlier thing, pure consciousness. What features this? It does not change. It has no birth, it has no death. It is infinite power, infinite knowledge, infinite bliss, infinite freedom. And emerging out of that is the whole creation. All this creation that comes out goes on changing and changing and changing. That's why it's called Jagat. Jagatyan Jagat, as Ishavasya puts it. That it goes on changing with it. And the unchanging dimension is called reality. Patanjali called it as Kaivalya. Probably Buddha called the Nirvana. And pure consciousness. Vedanta is called Brahman. Paramatman. That the self of all of us. And I call that as our real home. Real home from where all of us have come. And it's called moksha in Vedanta. And the ever-changing dimension, that the creation, has the seen and the unseen dimensions. And the seen dimension is the physical body, the physical world, and the unseen are the subtle and the causal bodies. That's the famous Panchakosha described in the Taittiriya Upanishad. Center, we have got the physical body, called the Annamaya Kosha, the entire physical world. Then we have, slightly bigger than the physical body, is the Pranamaya Kosha. Pranamaya, Manomaya, Vijnanamaya Koshas are called the subtle bodies or subtle layers of our consciousness. And then we have the Anandamaya Kosha, which is the causal state. And each of these layers have pervaded. For example, Pranamaya Kosha pervades the whole Annamaya Kosha. And Manomaya Kosha pervades all the other two. So also Vijnanamaya Kosha and Anandamaya Kosha. And according to yoga, all problems start in the Manomaya Kosha. Anandamaya Kosha, we are completely in the state of Ananda, that is bliss, that is silence. But in Vijnanamaya Kosha, when the differences start, we are different from one another, but there is complete understanding, total knowledge, and therefore there is no stress, there is no tension, there are no diseases, there is no misery, and in the state of perfect health. When we come to Manomaya Kosha, the emotions start emerging. That makes us more and more different. And slowly the emotions take over us, and we start acting according to our emotions, our likes and dislikes, rather than what is right and what is wrong. That's where the problems start. It's called Adi. Adi percolates down, bringing chronic imbalances and the imbalances in the physical body, that is the endocrine imbalance, autonomic imbalance, which was beautifully described this morning, and the stress reaction. And when the stress reaction continues for a long time, it settles down in the body as Vyadhi, a disease. All metabolic syndromes and others belong to this category. So, among the metabolic disorders, the coronary artery disease has been one of the major challenge, and all of you are aware of the wonderful work done by Dr. Dean Ornish. Dean Ornish has published the work and reversing the heart disease. The beautiful book that he brought about shows clearly with a lifestyle change program, essentially the yoga, it is possible that we will be able to reverse the heart disease. Because he has taken angiographic pictures which are 80%, 90% block, and after 1 year it has been shown that they have reduced compared to the control. Now recently a 5-year follow-up has been done that has been published, and again it is shown that these people who practiced the lifestyle change, which we did not call it as yoga, I call lifestyle change program, they were able to further this. So we also have similar work that we have done, and we have found a number of people who came and underwent the yoga program have been able to gradually move towards normalcy. Then we took another study. Those people already had a coronary artery disease and they had the coronary graft. That means they had undergone a surgery. What happens to them? This is a paper that was recently published in the Journal of Homework page, and what we did here was to follow them up. This is a 1-year research on the LVEF, that's affection factor. We had 1,025 patients screened, 250 Indian patients satisfied the criteria, were divided into 2 groups, a randomized controlled trial. And one is the physio-based rehabilitation, another was given the yoga. And this was the inclusion and the exclusion criteria. And the source of patients were from Narayan Hrudayalaya Hospital, wherein every day the outpatient has about nearly 150 patients who come there. And the design of the study was, we took the pre-operative data, then they had the surgery, then the 7th day data, 6 weeks, 6 months and 12 months data program, the randomized control. What are the intervention that we gave? Normally common cardiac rehab practice for both the groups were given. That is education, the practices of physiotherapy, intensive supervised physiotherapeutic breathing, first post-operative week, all these things are given. And in the yoga group, we had the yoga practices that were given along with these dimensions, And the integrated approach of yoga therapy works at all the levels, at the Annamaya, Pranamaya, Manomaya, Vijnana, Anandamaya Kosha, and these are the practice. Yogic postures, diet and kriyas, pranayama, you have slow breathing, and Manomaya Kosha, emotion culture, and so on. And these are the things that we did that. Then in the Vijnanamaya Kosha, we bring about the notional corrections and happiness analysis. Anandamaya Kosha, we bring the Karma Yoga aspect, that is how to work in a very relaxed way, action in blissful awareness. And the demographic data have been given here, and we could see that the things were well controlled. What are the results? This research shows that changes in the total weight of the patient have reduced more in yoga group compared to the control. Ejection factor has reduced considerably, and you could see the weight values have considerably reduced in the yoga group compared to the control. Ejection fraction is the main thing, EF. It shows that people who had more than 50, in the yoga group and the control group, you could see that there has been a significant improvement in the yoga group in this thing. Less than 50, you could see that here also we had. The total group showed improvements in both the groups. That is LVEF. Then we had the total UN and several other parameters. We had total creatinine is much better in the yoga group. We had the changes in creatinine, the total group, and the A1C, we call it as HPA. When see changes in the HPA also has improved in the yoga group much more compared to the control, and you could see that the total dimension of this thing improved, and the FPS also have decreased more in the yoga group compared to the control group. Changes in total cholesterol has also shown that both the groups have improved here in this thing, but here in this group the cholesterol levels have considerably reduced in the yoga group, who had more than 170. Triglycerides also have shown improvement much more in the yoga group compared to the control. So you could see that essentially all the parameters have reduced, and the medication is the most important. It shows that in the yoga group medication has come down compared to an increase in the medication in the other group. So that is brief work, and now we have followed up for 8 years of this the coronary artery disease things, and now we are analyzing the data, and we are getting very favorable things even after 8 years, and we are going to publish that data soon. What about diabetes? Another important dimension. And normally the managing of diabetes is based on the understanding of diabetes. And what is needed is weight optimization, physical activity, craving control, stress reduction should be done, most important, delay complication onset, better coping, quality of life should improve. And these are the ones that are needed for the diabetes. And normally the risk factors are obesity, and you have got the stress, the diet, and the activity control. So these are some of the risks which can be modifiable risks. So the diabetic treatment algorithm, according to the American Diabetic Association, tells us how we have to do that. You take the metformin, and we have these dimensions and lifestyle changes needed, and intensive insulin is done for the state tone 3. So integrative diabetic care, all experts involved in alleviating symptoms, all treatments being done to patient, various dimensions, and here comes the yoga dimension also with you. Yoga is the mind control involvement that has been done. So the diet will go over towards more and more of this dimension. So is there evidence of yoga? As you go through the PubMed, you could see that the large number of papers have started coming up with the yoga, as you could see year by year. And particularly the evidence for CAM in NIDDM shows that Ayurveda, acupuncture and yoga also comes up. These are all PubMed thing, traditional medicine, compared to the other things that we have. And what yoga that we are talking about? The popular understanding is contortionism, religious practices, workout regimens, and exercise and acrobatic, and often bordering on magic and siddhis. So the textual definition shows, as have been mentioned, yogaha chitta vritti nirodha, mastery over the mind. And the vritti nirodha includes the silencing of the mind, very important. One side, you increase the speed of the mind, another side, decrease the speed of the mind, make it very, very calm and quiet. And samatvam yoga uchyate, equanimity in approach. And skill control of activity, kaushala. That is to do all activities without tension, without stress, action and relaxation. Whatever work you do, can you do that in a very relaxed way, out of the dimensions, you know. And the understanding is based on the Panchakosha which we have taught, and at the physical level, at the prana level, the mind level, emotional, intellectual level, and happiness level. These are the dimensions we use. So, understanding the disease, as I mentioned to you, starting with the Manomaya Kosha comes down to Annamaya Kosha, cause the disease, and that becomes the Vyadhi. You know. That Vyadhi has to be done, that is the reversal that is needed. And yoga therapy, you know, physical health is a side effect of yoga. Goal is to reach an internal silent state of transcendence and pure consciousness ultimately. And avoid any practice that causes injury is the first rule. Rule 2 is involve the mind. Rule 3 is reduce the speed of the mind. You know? These are the things which make it very, very harmless, the whole process. And a lot of mechanisms have been studied as to how yoga brings about the changes, and it works at the psychological level and comes down to the nervous system and comes down to the physical level doing that. So, what is the evidence-based yoga therapy that we have? Diabetes. That is characterization, and animal studies have been done, safety and toxicity have been done, phase 1 and phase 1, and then you go to the treatment, efficacy, and the marketing. This is the standard way of doing these things, you know. Literature shows there is cumulative concepts, classify concepts, etc., and so on. And gradually we work on the healthy volunteers and diabetic volunteers and RCD trials, and stop diabetes movement we have started taking, you know. So our first work started in Royal Free Hospital in London way back in 1985, and we published this paper, Yoga for Diabetes. You know, in that we have shown that not only the FPS and PTBS reduce, but A1C, glycated hemoglobin, also reduces in the yoga group come to the control group. You know, what is the rationale? What is so different in yoga compared to the others? We all know that when you are stressed up, the stress hormones increase the sugar level in the blood by increased stress hormones, glucagon, adrenaline, cortisol, thyroxine, growth hormones, all increase the sugar level in the blood. On the other side, we have got exercise and insulin. And what we do in yoga is to see that the stress hormones are reduced by giving deep rest to the system. Mana prashamana. You give very deep rest to the system, therefore it starts working. Stress reduction is the key asset. It reduces the immune system normalcy, and autoimmunity is reduced. So we have measured the insulin resistance among the diabetes, and we have been able to show that yoga can reduce IR effectively. You know. And the research findings, we continue doing with the initial pre-post studies. We went into the randomized controlled trials, and we have published this paper. The 2-armed interventional RCT, 277 type 2 diabetics were done, 5 zones around Bangalore in a multi-centric trial we did that, random allocation to yoga group, and another is active control group, exercise-based lifestyle program. And we measured all the different things, glycemic indices, and we had the lipid profiles, we had, and what is the result essentially? Intention treat analysis have been used, and within the groups and between groups, analysis have been done. The conclusion says that yoga lifestyle-based program is similar to the exercise lifestyle program in reducing fasting blood glucose, then A1C, triglyceride, total cholesterol, and VLDL. But OLSP is better than the active control group in decreasing oral hypoglycemic medication. People who did yoga were able to reduce the medication significantly, and LDL, and in increasing HDL. This is a very key factor that we found in the yoga dimension. Now we are going to go to understand the mechanism as to how this happens. So, yoga can use for prevention, glycemic control, reduction of complications, and mechanism. Number of papers have come, nearly 81 papers are available in the thing, and therefore the integration will be done, wherein we have traditional descriptions, clinical observations, all that can be put forward to have an integrative model. So we started using in this country through the Stop Diabetes Movement camps a 3-month intervention, 20-hour supervised sessions, home practice, pre-post assessment. You know, we tried different modules, how to make it very easy for people to practice. That is, one day in a week, one day on a Sunday, or 2 days in a week, or every day they will come. Totally 20 sessions. Which will be the best? That's what we want to do these things. No implementation. So these are all the different testing modules that we did in the delivery in this country, and the results showed that if a person comes every day continuously for 20 sessions, he will have much more reduction compared to the other. But however, even if they come weekly twice, their things are almost the same with a marginal increase in the people who come every day. And that is the result that we have. So therefore we have standardized the protocol for yoga, coming 2 days in a week, every day for 2 hours, totally 20 sessions, and follow up in the house continuously. This turned out our system started, and we want to have the teachers being trained. Already we have trained many people. The first phase is yoga instructor course is 200 hours, then diabetes therapist training 30 hours, yoga therapy certification 500 hours, various things we have been doing here. And we found out what are the barriers for people to practice, the time. People say, I don't have the time to do yoga, I have never been active, I'm too tired. Various barriers have been found in the feedback questionnaires, and we have been able to solve most of them by this dimension. So in Indian model, the Stop Diabetes movement is slightly different. We have our work done in all different parts of India in 52 cities, and we have trained 650 trained teachers, and we have dealt with 1,774 patients, and recently we have added on another 500 people, and 2 hour sessions, 10 consecutive days, follow-up is ongoing on. In all these things we have found really a reduction of 20 units in this thing. So approaches for implementation has to be brought, and this is what we are going to do. Obesity is a very important factor in diabetes and coronary artery diseases. Therefore here we have got a very nice and very simple practice, a pranayama called Surya Anulom Vilom Pranayam. And when you use that, you could see that all the parameters improve. Not only the weight is reduced, BMI is reduced, and fat, cholesterol, triglyceride, all these things reduced just up to 2 weeks. What is the pranayama? It is the right nostril breathing. Close the left nostril, breathe in through the right. Inhale and exhale, 1 round. Like the 27 rounds, done 4 times in a day. Morning before breakfast, before lunch, before evening dinner, before going to sleep. If you do that, there is going to be a reduction of 2 kgs in a month. And how does it happen? When you breathe through the right nostril, Surya Nadi is going to get stimulated, and that is going to increase the oxygen consumption, 37%. And therefore, your fat cells are getting burnt up in the whole process. And that is the simple practice that we do effectively. With Asyasa University, recognized by the Government of India, we have 5 divisions, all the broad spectrum of yoga. We put forth yoga, spirituality, life sciences, physical sciences, management studies, and humanities. And now we have 150 people who are doing their doctorates, and master's degree they are doing 500 people, and totally we have 1,500 students, and now opportunities exist for distance education. And we have taken up with this, the base metabolic syndrome, particularly the diabetic control program here. And we want to first do the primary prevention. If the pre-diabetics do not become diabetic, the curve which is going up can be flattened. That's our first thing. And then the prevention of pre-diabetic becoming diabetic, control of diabetes. It reduces diabetic complication. Includes, apart from the young patients, relatives of the diabetic patient, those who fulfill the ADA criteria. And what do we stand to gain? The curve which is going up is going to come down. Unfortunately, in this country, the Indian population are having very high metabolic syndrome. And if it is about 14% in India, in US, the percentage is almost 24% of diabetes in this country. And so also in Singapore. Our friends endocrinologists are telling in Singapore, also the Indians who are there in Singapore is something like 18% compared to the Singapore population who have only 11% of diabetes. So we have taken up the Stop Diabetes movement in this country and started doing the different dimensions. So what are all the things that we can do is that the curve which is going up can be slowly brought down. And primary prevention, secondary prevention, and prevention of complication. If you can do this, even if nothing happens, they are not cured. At least if the moderate people will not become severe and get into complication, tremendous saving of our budget can be done. So this is the mission that we have taken up in this country, and we want to take this. And for that, we need outreach, doctors' awareness, insurance covers, which can be done, yoga departments in the hospital they can take up, and we can all work together as a combined whole to bring the things to make this possible in this country and also coronary. So further steps going hand in hand will stop diabetes camps, medical orientation workshops, randomized control trials, and deeper and deeper studies of different things, all are being taken up. Similarly, we have taken up the obesity control program in this country, and Vivekananda Yoga Research Foundation here has taken up this along with the Seva International and others, and we want youngsters to come forward to get trained, first as yoga instructors, then yoga therapies for diabetes mellitus, YIDM we call. And if you do that, then you will be able to offer your services to deal with the diabetics of various communities in this country and see whether it can be reduced. And the biggest challenge of obesity can be done very effectively using these techniques of yoga, very simple techniques of yoga, and we'll be able to control the obesity control program. These are the two main movements that we have taken up in this country. Well, in India, it is Stop Diabetes movement. In Singapore, we have taken yoga for diabetes and for cancer control program. In Australia, we have taken depression, which is the maximum in that depression control program. These are the four things that we have taken up: diabetes, cancer, depression, and the obesity are the four programs. And I welcome all those people who want to get involved in the social transformation process using the yoga as a lifestyle module are most welcome. We have standardized protocols, and we have been continuing the research. We have published nearly 320 research papers in various aspects of modern NCDs, and more are coming up, and we have high-tech thing that is coming up. Recently, we have set up a very big international standard yoga therapy and research section called Anveshna, in which we can measure the molecular changes that occur, gene expressions we can measure, and autonomic parameters, and most important is the subtle energies we can measure. The pranamaya kosha can be tracked using the GDV, which is based on photo imaging techniques and gas discharge visualizer, and we can find out what are all the changes that are occurring with the pranamaya kosha before and after the yoga practice. We can use this. And once again, I thank Ritaji and all of you for giving me a chance to share some of the things that are happening, and I welcome those of you who want to join the courses to join hands, and already we have trained a few people. Our Chakrapanaji is here, and he coordinates our work. Chakrapanaji, get up. And you can contact him here, and through him we will be able to coordinate in various parts of Los Angeles. We can join hands. Thank you all very much. Dhanyavad. Questions we have time? Okay. Any questions we can try? Any questions you have? You can spend a few minutes. Yes, please.
About 5 minutes.
5 minutes, okay, good.
With supporting lifestyle change, it takes time for people to change habits. Okay. And it's wonderful to see the studies and the encouragement.
Even within 20 sessions, in 10 days, we have been able to find that you can reduce the fasting blood glucose by 20 units. It takes ages to show these results. People who come to our residential program, they do it in 4 days, 5 days, 6 days, they are able to do. And they have a complete program of the lifestyle change when they do. Wonderful results come up there.
It's fantastic and very, very encouraging. In order for those people to maintain those good numbers, they
They have to practice 1 hour a day.
probably need to keep going. Do they
Yeah,
need support?
that's the barriers that we have found. We have done that. At least 2 days in a week, they should practice. Those people who practice 1 hour a day, everybody can spend 1 hour for their own health practices, for developing the health. If they do that, they can completely taper off the medication, become normal, and the sugar will be completely under control, we have found. We have dealt with 25,000 cases of diabetes so far.
The population I work with seems to need more follow-up. It seems so encouraging, but they don't follow up, they don't stick with it. And
So in the follow-up, we have found 3 types of groups among regular, irregular, and discontinuous. We had 8 years follow-up on COPD, and in which we have shown there are people who practice regularly get the maximum. Irregular people little less. And people who are discontinued, they also get the benefit, but much less benefit. The other question.
I think one of the things you brought it out that you are applying that yoga in 4 different
obesity, cancer,
Diabetes.
and depression. My question is, I'm a little curious why you limited depression in Australia when we know that 1 out of 3 people here are going through the depression in USA. I'm just wondering why you didn't.
We have taken the maximum thing, which is the one which is most prevalent in this country, which is the biggest challenge. Depression also is here. We will take up those things also, but it's a movement. We have taken the obesity here. Yes.
I have one question. I know your topic is, you covered a lot of areas. I will confine,
Now, can hear. Yeah.
I will confine to 1 or 2 areas for this because I know your vast
Yeah.
presentation. There is an institute called Predican Institute from Santa Barbara, California. They published an article where they followed the exercise and the diet for a period of time, where they demonstrated the reducing the size of the coronaries in people who had already had a heart attack.
Right.
Did you compare those studies? Or
Yeah, I showed you, active control group in which you have a diet, exercise, and normal medication. Compared to that, yoga.
Right.
Instead of exercise, they do the yoga dimension, and what is the change? In yoga dimension, we have found greater improvement with the increase in HDL that we have done.
The second question, or a comment maybe, the metabolic syndrome is very prevalent in Southeast Asians, particularly from India.
Yeah.
The Indians are famous for the high carbohydrate diet.
That is one. Another thing is basically Indians have the highest insulin resistance based on the genetic expression.
Yeah.
Now, among all the communities in the world, Indians have the highest IR. And next comes the Malaysians, then come the Chinese. Therefore, we are prone to become diabetic. And if our lifestyle is not done properly, then our incidence are going to go up. That's the main thing that we have. And by yoga, we have shown that IR can be reduced.
What's the contribution of the diet to
Diet also has a very important factor.
the incidence of
For example, lifestyle change includes diet, then stresses, and all these factors which I showed you there. All these are important. Diet is very, very important. But stress, which we can easily control, if you start reducing the stresses, then automatically control of the food also start coming up. So therefore, what we do is give this yoga program and see that the stresses reduce, then your craving is going to reduce. When you reduce the stress, the higher centers, the craving centers in the brain is going to get calmed down, and then that helps you. Therefore, you get better control over food. Everybody knows we have to control food. There is no thing. But why we don't do? Because our craving centers are so fast in the brain, it produces thing, and we have to calm down. Once you do that, then control over food also comes. Very important factor, diet.
Thank you. You're doing a great work. Thank you.
Thank you.
Thank you so much.
Okay. Thank you.
Okay, everybody, thanks for coming back. I'm glad we had a little break. And we have our final session for the afternoon coming up. Let me briefly introduce the person who will be moderating our final panel, Dr. Alexander Smirnov. He is a staff scientist at the NIH, as well as the Department of Health and Human Sciences, as well as a board advisor on science and research at the New Century Foundation International, a foundation which is dedicated to the study and promotion of yoga for the enhancement of the total wellness of individuals from all walks of life. He himself is an author of a number of articles in leading journals on microscopy, photochemistry, and biophysics. But today he'll be focusing on the human body and consciousness, which is another area of research for him. The title in the program has been shifted somewhat, and he will be speaking directly on this topic of the study of benefits from yoga and other mind-body practices. And then he will be introducing the final speaker and the workshop from the New Century Foundation on Chinese and Tibetan sonic and subtle energy bioenergetic medicine. So please help us welcome the last session for the day, Dr. Alexander Smirnov.
Thank you for this generous introduction. It's humbling to speak after such a distinguished panel of speakers presenting these impressive results coming from leading research institutes of this nation. I can tell you this quality of science we just seen is really impressive. Hope you all had a good break, and in case you still feel sleepy before beginning, let's do some practice with breath. How about that? Okay, so please rise if you have space around you, so you have some. Maybe somebody want to remain seated, otherwise you're going to bump into each other. Okay. Well, my background is not only in science, but also studying traditional practices of China, India, yoga, Tai Chi, Qigong. I've been fortunate to come across many traditions. So let me share something with you today, so you can be proud of it. Okay, just notice how your breath just naturally extinguish itself. Just rest. Then when you breathe in, make the sound. Very good, somebody lasted for a long time. Okay, now, how about feel your palms, and gently raise your palms and elbows as you breathe in. Wait until you start to breathe in, and with your breath rise your elbows, and naturally, when you feel breathing out, turn your palms down and let them sink. Good. Next, raise your fingertips, connect them together, and bring it to your heart level. As you exhale, extend hands forward. Separate to the side, bring in as you breathe in. A little stretch, and out. Then open, gently open, stretch, and up, without breaking the ceiling, just gently raise and stretch a little more, and come down as you breathe out. Good. And take a moment to take a breath in and stretch to the side. Leave the other hand in place. Extend the shoulder blades and come back. And again to the other side. And come back. As you breathe out, relax completely. Observe your breath now, with your mind follow how you breathe in and out. is what is changing your mind, changing your clarity, centeredness, feel sense of connection, your body, your mind, your breath. Thank you. Please remain seated. All right. So, let's begin. Again, thank you for organizing committee, Dr. Sharma, for inviting me here, and also Dharma Foundation for supporting many speakers here, including myself. Initially, my title was, what I come up with, sounded as the benefits of yoga and other mind practices for health and well-being. But then I thought, well, it looks a little bit biased. How do we actually know there are benefits? We all want to have those, so I changed it. Studying benefits of yoga and mind practices. Let's see what we can learn. So the subtitle is Meta-Systematic Review, and maybe we'll share some of my biophysical ideas with you, how that actually may work in our bodies. Okay, as a government employee, I have to make a little disclaimer, saying basically that even though I present some research results from government institutions or whatnot, it's definitely not an official opinion of any of our offices or departments or my own lab. And finally, that this is also sponsored by New Century Foundation, which recently approached me to be on a board of the advisors for science and research to help promote yoga and practices. As I was preparing to this talk, a number of events happened, lots of events. Some sad and some not such, and some joyful, of course. But we all seen passing in a few months great teacher, yogi, and therapist, B.K. Iyengar, who I was fortunate to meet a few years ago when he was making his official last visit to the United States. So there I learned that what we see in his gave here this sense of dedication and stamina and perseverance that he imparted to his students that needed to overcome so many challenges when they applied yoga as a therapy. Now, another person that you all know and that I admire so much, Robin Williams, my favorite actor, as I discovered coming to this country. And actually one of the first movies I seen with him called Patch Adams, where based on a real story, where laughter was used as therapy. And of course many of you know there is such thing as laughter yoga. How many of you heard about it? You can even get workshops. Alright. I'll come back to his life story. By the way, so generous person, and I think that he went to Iraq many times, and he's being with soldiers changed lives of so many people, including those who were remained here at home. Okay, before you start dozing off again, here's a plan for the talk in case it's just to wake up at one of those. chapters. I will just briefly cover what are mind-body practices that we like to study so much. Then what evidence in literature we see benefits of such practices, Tai Chi and Qigong, and then compare this to yoga, and what can we learn from all this research. And then I will share some of my own thoughts about it. How does this all work? And speak about more sonic and energy breath work that you'll get a chance to try later. The resources are not really far to find. There is an excellent couple of books you want to familiar yourself if you want to study mind-body therapies. One is, of course, a recent publication called Complementary and Alternative Medicine for Health Professionals, Holistic Approach to Consumer Health. It gives you a big, really nice historical background and ways to study these medicines. Finally, if you want to really start clinical trials, this is a great course that was put together at NIH, and there is a book associated with it called Introduction into Principles and Practice of Clinical Research that I was fortunate to take part in. Really mind-opening course, and actually it's now being broadcasted in several locations across the world, like in South America, Europe, even Russia. Okay, and for general information, you can always go to my clinic website that has a cover of all major practices, and also NIH has nice few pages on website of National Center for Complementary and Alternative Medicine, where you can see also videos of Tai Chi, Qigong, and other also yoga. Finally, for free search engine, you can go on PubMed. You can also use Google Scholar and things like that. You get a very good sample of what is available in the literature. Of course, Wikipedia is another great resource. But a lot of things I get from really personally communicating with people who actually engage in these practices, and also finding my own experiences. Okay, so a meta-review, systematic review, has been done very recently in the International Journal of Yoga. And you already see this picture today, where there is like exponential rise of publications in the just few years on yoga. And this not only like original publication, there's also studies about studies. So a review of studies yoga for breast cancer, or a review of studies Tai Chi for diabetes, and so on and so forth. And I'm sorry you can't read here, but these are all different conditions that yoga articles were covered. So it ranges from like anxiety, depression, pain, cardiovascular disease, body weight, sleep disorders, anything you can imagine. What is mind-body practice? Well, from my own experience speaking, well, that's when your mind remains alert. There is a focus on what the body is doing. There is a focus on what your breath is doing. That's in a nutshell. What kind of practices that generally involves? Yogas, Pilates can be that. Creative dance can be a mind practice, mind-body practice. Qigong, Tai Chi, martial arts, especially internal arts like Aikido, really involves a lot of synchronizing, harmonizing with breath. Then there are things like biofeedback and so on and so forth. What is, but it's not just work, it's also alternation with relaxation. So these all practices have to have in them both tension and relaxation, breathing in and out. Okay, so what happens in the end? The flow of vital energy is harmonized. Maybe there is a blockage somewhere, maybe it moves too fast somewhere, but that all helps to come together. And what do they call this vital energy? Different traditions use different words. In Hindu, there is prana or vayu. In Tibet, there is lung. Funny names, same as one. Yeah, that bridges our air. In Chinese, qi, chi. Japanese, ki. In science, we call it bioenergy. And what does mind leads to? Mind is either focusing on a specific task or is just empty. Simple mind, open heart. Okay, by the way, here it is from Hindu tradition, a depiction of Mukha Prana, the chief of life, the essence of all the energy which can exist in many different forms. And you can see flag, you can see him being comforted, you can see him on a gazelle which is moving fast. So the essence of it is energy is always moving. Where does it move? Maybe that's mind can tell us. So let us begin with practices we find in China. Qigong literally means working with qi, or cultivation of life essence. This is the practice of aligning body, breath and mind for health, meditation and martial arts training. It actually has different styles. Some call it internal male work and external well work. Different breath work involved. We know it appeared in China a long time ago. And thousands of forms have been developed through ages. And let me point your attention to Chinese characters that depict Qigong. Qigong. And what we have here, if you break it down, is actually two characters in one. The top is kind of a wind, blowing air. And the bottom is actually rice. So what will happen is when you put rice and air together, you get carbon dioxide, water, and energy. Okay, so, and then we put that energy to work. That is what's said here. And this is from very well preserved silk scrolls that found in an ancient grave that has been excavated this century. These are Taoism exercises which one of the most ancient types of yoga that were discovered as a coherent system of exercises. There are many other interesting forms of Qigong. There are some that based on animal movements. It's one of the famous one called 5 Animal Frolics. Then there is one discovered on 8 pieces of silk, so it's called 8 pieces of brocade. And that has been studied in China extensively, with biomedical methods scientists looking at the blood chemistry and everything and found very beneficial. Now it's very popular in China. And there is a Dawu, also called like big dance. It really looks like a very graceful dance, very gentle motions. And the interesting story I heard about it is at some point in China there was a big epidemic of bubonic plague. So emperor ordered people to come outside and practice this big dance. And the epidemic went away. So I think if you remember recent news that inspires something. So we have always challenges with Ebola virus, SARS virus, and so on and so forth. So here's how we can perhaps get prepared for future challenges. Then there is there is not so popular but well-known practice called 6 healing sounds of Qigong. And maybe you can try that later today. So how is it different with Tai Chi? Well, Tai Chi is actually based on exactly the same principles of positive and negative staying in harmony with each other. So it's called yin and yang, as you all know. And the idea is, this is not a static balance, but it is a dynamic balance. So this symbol is actually, you can imagine, is it turning around over time. So day and night changes each other, hot and cold, moon and sun rising and falling. Tai Chi, that is the meaning. Qi, Ji, means this harmony, this limit when these both forces are in balance. So that's why I like spelling this way, Tai Chi Chuan, not to confuse with Qi, which is energy. And of course my Chinese pronunciation is far from perfect. So, also Tai Chi is often called a meditation in motion because the way you actually purposely slow down your motions so that you train different kind of muscles in the body and you allow time for Qi to adjust in the body so that it can be moved from one place to another. But I won't go into detail. You all recognize some of these forms. Grasping bird's tail, waving cloud hands, wave hands like clouds and such. They're actually very close to each other. There was a study that actually put combined results of studies of Qigong and Tai Chi, compared them to each other, and found, there is very many similarities. Actually, what is practiced as Qigong, as Tai Chi, looks very much like Qigong, because Tai Chi is purposely meant to be a very complicated set of motions, complicated exercises. So it's sometimes, if you even see it, and many times somebody shows you, very hard to repeat it because it is meant as a martial arts style, so nobody can figure out what is your actual emotion, what is your actual intention. So when we look at the studies of Tai Chi, it is usually simplified forms that actually look a lot like Qigong. But Qigong has its advantages in terms that Tai Chi is more fun, I can tell you. Qigong is a little bit more repetitive, but you can do it sitting, you can do it standing, depending on the style. With Tai Chi, you do want to have a good sense of balance, and actually, before you can do it, first you practice Tai Chi walk, so that you can even walk properly before you do that. Harder to learn, but maybe more benefits. As alternative therapy, Qigong was found significantly improving anxiety, depression, insomnia. type 2 diabetes, so other autoimmune disorders like arthritis. Of course, strengthening immune system, well, that's actually not very, that's a bit surprising. Why would this gentle exercise improve the immune system? Of course, well, cardiovascular disease, hypertension, also kidney function improve, help with reproductive disorders. Maybe there is gentle breathing help with asthma conditions. Now, Tai Chi compared to Qigong have very similar effects, but even maybe sometimes more effect on immune system, and especially improvement or response to vaccine. So you see, when people get vaccinated, they often receive attenuated live dosage of the virus. So some people actually can get sick from this virus, but practitioners, compared to control group, they actually develop enhanced response to the virus, so they can fight the virus better. Another interesting application of Tai Chi was in Parkinson's disease. So you see, in Parkinson, the motion coordination is perturbed. So people have tremors, they may not be able to walk straight, or they lose sense of balance. If you start early enough in that process, the balance really improves. You whatever lost function of neurons, they get retrained. So people now can find new ways to control their balance. So this is an example of a study that was done in New England of Medicine, published in New England Medicine, Journal of Medicine, where patients did a Tai Chi routine with Parkinson's, with condition of Parkinson's. They use these slow motions and extended hands, and they've seen therapeutic effect. Now, what are the challenges? Well, if balance is cannot be held, you can easily fall. And if you may have, Tai Chi also puts a lot of stress on the knees, because you have to slowly move your weight from one leg to another. So then the problem with arthritis. Also, if some people have poor attention, especially in old age, it's hard to move. But at the same time, this can be an extra stimulus to the brain, so people improve their brain function and maybe can slow down the development of Alzheimer's disease or something like that. So before making conclusions, let me move on to yoga as therapy. From what we heard, that yoga means connection. In Sanskrit, in Tibetan, it actually means transformation. Okay, think about that. This is mind-body practice originated in Tantric philosophy, dating back 5,000 years before Christ. I also developed a kind of separately isolated branch in Himalayan and Tibet before and even after all of Buddhism. So there is numerous branches, varieties of yoga. Hatha, Rajat, Jnana, Kriya, Laya, Karma. Now almost any letter of the alphabet you can pick. Of course, in the United States, we're more familiar with Hatha Yoga. Actually, 2007 National Health Survey showed that yoga is one of the top 10 complementary health approaches used among adults in the US. And about 6% of adults used yoga for health purposes in the previous 12 months. I'm sure this number is growing. It's probably, 36% exponentially. The yoga we generally practice here in this country is hatha yoga, and as we just heard today, that means unity of sun and moon. Just like yin and yang in Taoist practice. And there are different variety of schools, such as, this is in alphabetical order. Please forgive me if you do something that is not included here. But most important points that include yoga are ethical principles, body postures, asanas, and breathing exercises, and which leads to concentration and meditation, dhyana. So when study is done, hopefully it includes at least these 4 aspects in some way. Of course, concentration and relaxation, as you know, shavasana is done at every end of every yogic practice. Then there are other interesting schools and traditions of yoga that also include such things as hand postures, called mudras, vocalizations, mantras, and a muscles lock called bandhas. And you can also work with a partner with those. And these all are purposed to harmonize flow of energy that is stimulated by the postures and breath work. As complementary and alternative therapy medicine, yoga has been shown effective for anxiety, depression. A lot of recent research in PTSD, of course, insomnia we just heard today, type 2 diabetes, metabolic diseases. Many people report the allergies from air pollutants go away. That's oftentimes after doing cleaning exercises called neti. When there is cardiovascular diseases, high blood pressure can be controlled, lung diseases. Then many people included their yoga practice when they were recovering from breast cancer, undergoing chemotherapy and radiation therapy. When you're really low on energy, and there are all kinds of side effects from therapeutic drug that comes up. And lots of studies shows that yoga really helps elevate this energy and overcome also side effects of depression and changes of perception. Your taste may change, your appetite certainly goes up and down. So, such things also related just to muscles and bone structures. Osteoporosis and lower back pain is helped a lot. But there are some questions that we need to exercise when we practice yoga. So sometimes excessive blood pressure in your eyes, called glaucoma, has to be dealt carefully, especially when you go upside down in inverted asanas. Sciatica, the pain in the nerve that goes down, can be a challenge because there are lots of sitting postures, and there are, of course, there's severe problem with balance. Is difficult to do yoga. And if the bones are very strong, unfortunately, you can get fractures to the bones. Also, some of the research tried to study asthmatic conditions and have not been successfully consistently showing results. In fact, if there is a severe respiratory problem, yoga is difficult to do because it puts a lot of strain on your lungs. But there are other benefits for well-being. So people report, these are so-called patient-reported outcomes. They are hard to measure sometimes. So increased resilience in stress, mood improves, again immune system, less chances of cold, and sometimes, as we've seen, the diabetes and high blood pressure can go away. Also, in later stages in life, women can have a great relief from postmenopausal symptoms. So, how do we approach study of all these effects? We start from anecdotal evidence. If that is interesting, we'll see if you can build a group called cohort. Then, if you can plan a little bit ahead, get some statistics before and after practice. The next stage would be comparing it to a control group that does nothing or does a similar practice but not with emphasis on particular asanas that you think are effective. So let's call it sham study when you have some activity that is similar but not meant to be effective. Finally, it's really good if you can arrange the trial so that participants don't really know if the practice real yoga or real tai chi or not. That's called blinded study. Now, people who evaluate the patients also can be screened from knowing what this patient did, which groups they were involved to. So that's a double and triple blinded trials. So when planning for such studies, there are always challenges to overcome. You have to have enough people in your group. Say you have 4 people in your group and all of them report some kind of positive effect. Well, that is considered to be no result from the mathematical point of view, from a statistical point of view, because you can be just lucky to have these people respond on their own, just by the nature, without any intervention. So when you recruit people, you also want to make sure they're either very homogeneous or very different from each other in both control groups. And these differences are about the same in both groups. You want to make sure they practice what they're told to. Maybe if it's a blinded study, you don't want them to talk to each other. So they're not affected by the expectation of the practice. Same goes for people who evaluate the effects of the therapy. Finally, participants may leave study or they may have adverse effects, and we want to know what to do, how to analyze the data when you have less people reaching the end of the trial. And in the end, you want to meaningfully analyze all this data so that it can be published in peer-reviewed journal and accepted for publication. So what are the take-home messages? to do the study. Yes, get as much cash or donation as possible, because there are so many studies that almost seem like a waste of energy and time when they were not planned accordingly, or they didn't have enough participants, or the way it was practiced was inconsistent. So a good review of literature and, talking to biostatistician should really let you home in on what kind of study you can do diligently with the amount of resources available. So once you agree on the plan, you get as many participants as possible to get the statistics meaningful. Then you select candidates, not bias, but eliminate any potential strange results due to personal genetics or predisposition or certain other conditions that the person may have. If people are, and oftentimes they are different, so you would have to not let them choose which group to go, but randomize it, because some people may have more expectation, may have more propensity to do Tai Chi or yoga, some people like do more reading. So, and that can affect, that already has effect on their lifestyle. So then you want to reserve some money to actually encourage good participation in the trials, so that people don't drop off, in the middle of the trial, and so that they actually diligently do what they were instructed to. If it's double-blinded study, as I said, you want to avoid any straight interaction with participants of the other group. And in the end, you sit down with biostatistician and again analyze all the data, all the happenings, and come up with a proper analysis of the data, so it can be viewed as legible results. But, numbers unfortunately don't tell the whole story. This might be the main point of my talk. But let's think about it. Being aware of all this, is it possible to genetic variations when we pick people for studies? Well, there are also now, we know that genes are not the whole story. There is a message that is encoded on top of those genes that comes from our ancestors. Now, then there is habitual, cultural, religious tendencies that is unique to each of us, especially in this country. Finally, each person may have their own personal constitution, their own humor, especially you know that if you practice Ayurvedic medicine, right? Then family status, social status is have tremendous effect on what we do, how we do in these practices. And there can be some genetic life experience each of us has, and this psychological component may even prevent you from doing certain kind of practice. You think about soldiers with PTSD, and they have flashbacks, and they lose awareness of what they're doing, and how it's done properly. But there are more than that. As we quantify, unity or connectedness that can arise from this practice. And this always comes from talking personally to people. Sense of belongingness to a group of like minds, acceptance of existing conditions, new phenomena, opening of the heart, quietness of thoughts, emptiness of the mind, building up confidence, self-efficacy. People can start being so much more confident in going and do things in their life. Balance of inner and outer energies, happenings. Finally, this feeling of inspired by heavens, supported by earth, etc., etc. So, maybe I'll say about my ideas on how does this work, and a little bit later as we go through the workshop. But I want to conclude coming back to these two wonderful people. Iyengar would be very proud to be here today and know what progress we made in attempting to bring yoga into therapy for a variety of conditions in people's lives. And Robin Williams brings to mind notion that laughter is a great help in life. But laughter and humor is not all that sustain us. Yes, he had most advanced health care system in the world, and some people may feel that it failed for him. But there is a hope. Maybe if he had a little more joy in his life, joy that comes not from reason, but just that arises naturally, spontaneously, maybe he would be still with us here today. And there are not many individuals that have gone through similar experiences and survived. By the way, this is a Ray Patch Adams that had his clinic open in Virginia a number of years ago. He traveled around and was in Tibet and other places. That's what he is. And so, with that, I want to introduce you into another kind of yoga that you may want to try today, called Yoga of Joy. It is promoted by New Century Foundation. It's a non-profit organization that unites volunteers to promote practices of yoga from Tibet for wellness in 21st century. And we also encourage and support studies of benefits for human health being and education. As our founder says, we will support your journey for the future with pure love. May we unite our awareness. Breathe, be courageous, be ready to embrace every single moment with pure joy. Foundation has numerous activities throughout the world, such as book signings, concerts, workshops, retreats, radio interviews. We also come out to educational institutions like here, University of South California, and Loyola Marymount University, which is photographed here. Some of our practitioners have shared their experiences in various ways. There is a book you can find on Amazon called The Fearless Way. And by the way, the author is here in the audience. People reported dramatic changes in their condition, whether it's heart, liver disease, back pain, coping with chemotherapy. These are these wonderful people who, some of which are here, and you can meet them, and they do a tremendous job in promoting Yoga of Joy for the well-being of all of us. Without further ado, let me introduce Yoga of Joy founder, which help you experience some of it for yourself today. So I won't talk much about it. So Yoga now is here with us today. She is born and raised in China, and I was fortunate to have a unique experience with her grandmother, who imparted the so-called Dakini lineage through a number of interactions that started in her early childhood. She is a writer, a performer, educator, an artist, a survivor, and of course, above all, founder of Yoga of Joy and initiator into this practice. Please welcome you now, Yoga of Joy.
Hello, thank you. Thank you for the Dharma Foundation, right? And Rita, all great energy here. Thank you. I learned something not from like the school. I don't have a PhD. I learned something from my grandma. Like since I was little, I grew up by my grandmother. My grandmother was Tibetan. Her hometown is Kangba. It's East Tibet. So my mother said are Chinese, are Tibetan. My father said are Chinese. So because I learned from since I was a baby, grew up by grandma, unintentionally I got some blessing and lineage. I'm so sorry, I don't use computer. I use a paper. The paper is old. It means the old paper can carry some old, ancient information, I hope, right? So first I have to share with you about the song. Because one kind of Yoga of Joy is song healing. We just did the song healing in China. It was so successful. I heard, since I was little, I heard from my grandma. Grandma always doing the word transformation to me, not from the book, not from the school, not from the public, just only esoteric, one-on-one. That he told me, do you know what's life? I said, what is life? Life is sound, it's a vibration. She said that in the woman has the egg, the man has the sperm and the bird, okay. Okay. Even the egg and sperm, they from nothing and creative become ready to have a baby with all different vibration. But she said, each egg is possible to have a baby has 36 子音和母音，怎么写就写上 ？Yeah. Okay. 那名字the man the sperm a bird right? The spurs sperm yeah also has 36 子音和母音 equally 36 and 36 so when the sperm met the egg they have good kind of some kind of I don't want to say coincidence but some kind of affinity one sperm worm into the egg okay the 36个 36写成36个 yeah 36 make together become one and that moment is the life began from that vibration 36 together become one the one make a big sound but so subtle we cannot hear but somewhere some kind of dimension can hear that sound when the sound happened the other called the spirit looking for reincarnation yoga has to know reincarnation is a normal word so some spirit looking for the right way to reincarnation they heard the sound okay they found their next life so the 36 plus 36 equally 72 72 for this knowledge growing becomes some kind of story. In Tibetan and Chinese, we have a monkey god, similarly like Indian. Indian called Hanuman, right? But in Tibetan and Chinese, we call Sun Wukong. So Sun Wukong, the monkey god, he had great magical power. He can transformation into 72 different forms. Where 72 come from? Because the egg carry 36 different sound. The sperm 36. They meet together like a many dimension, many multi-level form with the life. So in China we call Sun Wukong, also called like a monkey god, great magical. He can transform into 72 different form. So when the 36 plus together become oneness, make it one sound. What the sound was wow. If you use the machine, maybe when the high tech developing more high, more advanced, you can check that moment has sound. A sound is wow. When the wow, maybe we can do some proof. Any baby, no matter what kind of country, ancient, modern baby had birth, first thing he did was wow. The body has a memory. The body has the nature to remember the mantra, the vibration. So everybody, first bird has a water, wow. If the baby didn't doing wow, human said crying, baby crying. Crying is a little negative word. But if the baby didn't crying, the parents will be worried. Why my baby silence? Why my baby didn't make noise? Because that's really healing for the mother, healing for the father. By wow, this is a mantra. That means through chakra, the life opening from through chakra by Wa. And the Wa comes from the mother's 36 son, from father's 36 son, become one is called Wa. So this is a little knowledge comes from my grandma. But later on, I checked so many books. I didn't find scientists to prove it. But I believe it. You think about that. After every baby did a wow, like a big vibration. Oh, I'm humming, wow. Parents say, oh, my baby's so strong. Listen to the sound. How powerful, how strong, how healing. So if the baby don't wow, some problem. doctor said baby has a problem, weak. See, the wah has such great gift, is healing. Listen, and from the wah, pure, simple wah, and little bit growing, little bit developing from what? From mother, father, papa, mama, abba, ama, everywhere you can see the baby called the parents. From the mama, abba, ama, ana, dana, baby laugh, so pure. And later, they grow up. They become some kind of learn something a little bit complicate their mind, and they still use the most pure democracy. Hallelujah. Amen. Amitabha. Allah. Prajaparamita. Most holy word prayer with the why? Because our body is a memory. The nature of our human body has a pure vibration. See, when people are healthy, emotional healthy, they laugh with like this. When people have problem, they struggle, they fear, they laugh. So, right? You can really. We have some professional doctor, but we can all be. Everybody equally has some healing gift from our nature. Because we made it. We made by the song, made by the pure song, made by the very harmony, very pure vibration. This is very good. The old paper carries the old information. So now I like to use, first we do two different kind of experience. We have great scientists. We call him Harry Potter. I don't know if you recognize his Harry Potter. The scientist Harry Potter. The scientist Harry Potter has great knowledge. He put so many information making me dizzy, but eventually okay, I'm totally agree with you. I'd like to share with you the Vata breathing. Okay, 7 Vata breathing. Okay, I talk a little bit another ancient old information. Use the old paper. Nice. You know, also another learning I learned from my grandma. My grandma told me when I was little. Grandma said, "Hey, you always being appreciative about everything, and appreciative about our ancestor. We are really much appreciative of our ancestor. I'll say, oh, this is our ancestor, Lao Tzu. This is Pama Songbawa, the Tibetan lineage, Mimapa, Pama Songbawa. This is our ancestor." Grandma said, not enough, okay? To our ancestor, you have to very much pay attention, because they are a very special deity of you. Deity. So but it's very easy for you to remember the 2 ancestors are old men. One old man wear the black cowl, long hair, black cowl. The other old man, he's always with the white cowl. When I was little, who are the old men? I said, that old man called Lao Tzu, who's with the black cowl. The other old man called Shiva. Shiva always with the white cowl. And he told me, don't think it's just a cow animal. No, the black cow, the black in the Chinese 5 elements, metal, wood, water, understand? Yeah. So metaphor words, and word growing from water can raising the wood. So the black, the color with the cow, meaning is water. Water. The world has 70% water. Our human being has 70% inside of us. Also, the cow meant for mother energy, the divine love, divine compassion. So the black cow with the old man, Lao Tzu, to teach you, you have to always purify your body, shui, like water, always floating, never getting frozen, emotional not frozen, your mental not frozen, your body not frozen, always be active. The man who nearby have the white cow, a Shiva. A Shiva also is our ancestor. Even he doesn't look but he's our ancestor, great deity. Why he with the white cow? The color with the white, metaphor wind and breathing, connection our lung. So the two old men, also the cow, also metaphor mother. See, Indian Shiva with the white cow, metaphor the mother. The mother can help people to throw the blooming the wind, to cleansing the cloud, cleansing the obstacle. So the two great ancestors, you have to follow them. When I was little, I said, oh, yeah. But now, more and more, when I got a little bit mature, I realized what? The white cow, Shiva bring yoga breathing, metaphor, breathing the phone, wind. The black cow with the Lao Tzu is the water, together called the feng shui. Feng is wind, shui is water. So feng shui, any kind of practice, no doesn't matter. Taoism, Qigong, Taoism, Tai Chi, or Tibetan yoga, Indian yoga, everything just help us make our life feng shui better. The world feng shui better, getting better feng shui. Our family, our business, our everything. Better feng shui. Easy, feng shui. Good feng, good shui, good life. Small white cow, black cow, Lao Tzu, Shiva, they are brother. They are our ancestor. They bring the big positive blessing feng shui to us. So now I'd like to share with you the part, 6 yoga breathing, Vata breathing, Veda. Okay, please. Yeah, we've been teaching this kind of practice years. Many people love it. Veda so great, and he teaches well. Okay, you please, yes, please.
Thank you. Hi. Once again, you're invited to please stand up. This is experiential for you. We call this the 7 breathings, or the Vajra wind breath practice. Our lives are bookended between our first and our last breath, and our breath informs our life completely. This is intentional breathing, mindful breathing, joyful breathing, if you will. So without mental concepts, without too much thinking, we'll do what the children say, like Simon says, we'll just follow along. My dear friend Susan will narrate a little bit as we go. It's just so you get that there's a bit of mind science behind the body movement. And what I invite you to do is to take a moment at the beginning and just close your eyes for a split second and notice your state of mind, your state of being. You've been sitting all day, however you are. One breath, inhale, exhale. The Vajra wind is a series of motions, sounds, intention. So without further ado, I'll pass the microphone. Follow me if you will. There's no wrong way. There's only an exploration of how to breathe. First to wake us up. It's 7 series of 7 breaths.
7 sounds to take care our 7 different organs. Yes. First,
Inhale.
Releasing anger.
Open up.
Press the sky.
For your lungs, releasing sadness.
Eyes wide open. Hands fall like rain.
Eyes wide open.
Relax your eyes. My heart is smiling.
For your heart, creating peace and harmony. For the stomach, releasing worry and anxiety.
With the wind through the trees.
For the kidney, releasing fear.
Make your kidney strong. Immune system and chakra.
For the 7 chakras, balancing the chakras,
Immune system. Immune.
supporting the immune system.
Flying. Okay, I need to fly. Rotate the earth mother.
The tongue is pointed to the back of your throat.
Open your inner eye.
Tongue rolled back to the back of your throat.
Sit into later you can sit into this. Now you can sit down. The last song. Sit down. That's your hormone. Sit down, comfortable, very lazy, do nothing. I know you're so good, everybody's so great and learn, great scientists, but now you learn, do nothing. No identity, no work to do. This is yoga way, do nothing. Relax, lazy, so spoiled. So lazy, so spoiled. I will do
Left hand, right hand. So for men, your left hand over, right hand covers, and then your right leg crosses over your left. And lazy, just like a breath. And for women, it's like this: right hand, left hand over, left leg crosses over right. So take a breath.
This is for your hormonal and endocrine systems. Integration and balance. They have me with the concept, just doing it. And you know the corner of the lip naturally up, smiling to yourself. Smiling is the best blessing. It's good vibration, good sound with smiling. So there's a girl, Laventara, who in front of you, she got a very serious cancer a few years ago. She been practicing this kind of yoga of joy, breathing, she got healed. If you want to know her story, your book called Fearless, right? Fearless Way. How does she practice, continue intensive practice? Serious cancer got healed. She's here, it's beautiful, healthy. Easy, lazy, no concept. Relax. Yes. Thank you.
Thanks for playing with us for a few minutes.
Why do this? For a clap, for thanks, you're good. For another song, my grandma told me. This is called the Earth song. Earth. We do this. It's Earth song. This one is Earth song. So when you do that, if you're energetic, then you do Earth song. You vibrate yourself. So it's good way. Earth song, yeah. When you do, don't be too elegant. Do something wild. You feel very different. 1, 2, 3, do it. See? So yogini has to be like a childlike. Even you're very special scholar, inside of you still like a child. That's the yoga way. So, see, the song there. Also, grandma told me that, for the song, there's 5 different, basic, essence of the song to healing our body. Wood, let's say, flue, made by wood. The wood can help our liver. And the metal, any kind of like bell, down the bell, ding, metal, good for our lung. The water song, what's a water song? It's a drum. Drums that are made by the cow skin. They call the water song. When you hear the drum, good for our kidney. Also, the best water song for help our kidney is the storm, grandma said. Many people scared about the storm. So they come down, it's so scary. They don't know. When the storm coming, you just open your heart, inhale, exhale to absorb the sound to your kidney. That's the best medicine with the storm. Another song called 金木水土是 dirt, made by the crystal, rock, crystal, any kind of instruments made from the earth, rock, crystal, good for our stomach. 金木水 fire is like a guitar, have string. That kind of music, that kind of instruments has the fire essence, can good for our heart, good for our physical heart. So if we know the very traditional and very, very knowledgeable and very works, we did a lot study. It proves. Okay, if you really have this kind of interesting, you can in the future spend some time to enjoy. You really feel your body has feeling. So this is another very old traditional song knowledge. But now we have a little bit of time. I'd like to share with another song called the life song. With the phone, the breathing, okay? Still, I want you just do nothing. There has no sound going to happen outside. Everything just reflection from your inner life, your situation. So no religion, no prayer, no anything, just vibration. Thank you.
Thank you. Thank you, scientist.
Thank you, teacher ma'am. This reminds us vibration has tremendous power, and I don't know if you feel, but how different sounds can penetrate into the body, and you have the sensation in different organs. And if you, I was thinking, just mechanically, you know what is a resonance is? Resonance? Each organ has its own shape, size, its own density, its own kind of rigidity. So what does it mean? Well, it means it will respond to different vibrations differently.
Yes.
You know, it will become in resonance in different according to whether it's solid or empty, whether it's flexible or strong, right? So, and that's what we learn now. Even on a cellular level, each cell is constantly sensing pressure from the outside, pressure from inside, shear, like kind of motion of if something is gliding on the cell, and instantly responds, even onto the DNA. You know, it's all connected to the DNA we know now. So, thank you for experiencing today this ancient tradition, and we'll just do our best to find connection to some science.
Okay.
Yeah, because our Harry Potter mentioned about meridians, right? Meridians channel. Yeah. So 72. So for Tibetan or Vajrayana way, Grandma told me that so each human being, everybody has 7,200,000个是 72000 that kind, because from the 36% to 72, that kind of meridian in your whole body. Yeah, 24,000 okay, 24444 is the blood meridian. 24000 is the qi meridian. Qi, he talking about qigong. Another don't waste the paper, so ancient. I'm sorry, okay. Another 24000 is the essence meridian. Totally 72000 meridian. So the three part 24,000 meridian is qi meridian. You do qigong, good for the 2024, but not all. That's why qigong, Tai Chi, mostly qigong and Tai Chi take care of the 2400 qi meridian. We also have 2400 blood meridian. Blood meridian is carry the water, carry the, Also, another 2400 is like a essence meridian. So, her part of the DNA. Okay. My grandma told me, in the future, the new Earth, the new future, human beings will developing their meridian more, become 9000. This is they have long, very psychic version. Because of what? Because the world, so many change. The food change, the weather change, the 这个转基因食品怎么讲？转基因食品，基因 food。Yeah. So we are human beings. We are very strong. We're very strong. You know what? You change, me change. You developing your chemical, I developing my potential, my ability. I can handle it. You know what? Divine allowing us to do it. Shiva allows to do this. Shiva allows our ancestor love their children. You say you change? Okay, I give you more. You change. Go through what? Go through practice yoga, meditation. Go through to have faith for divine, has great compassion with the world. You can developing our more potential to handle those chemical, handle this pollution. You know what? This is the divine gift. But you only can practice yoga, practice meditation, practice faith. You can receive the blessing. This is a very, very ancient but a very new message. Also come from grandma, come from the ancestor. They have such great long vision, dharma eye to see the future. So I'm so happy today. Rita and the organization called Dharma. Really Dharma. This is really Dharma. Great Dharma to do this. Now it's time. 2014 is the right time to do it. To weaken people, to be bravely, to positive, to trust doing our work. Yoga, meditation, positive thinking, everything positive, everything to help ourselves, to help the world. 你写下来了没有？ Yeah, so 7, this is, because he mentioned about the DNA, reminds me. Thank you.
Yeah.
Okay. You now your time.
I'm just have a question. Is it possible your grandmother made a little miscalculation? Science says we have 23 pairs of DNA, and why there is 36 pairs?
They have their own way.
Well, this is just a joke. Because besides DNA, there's lots of other things happening in cells when the new life is formed. Okay, there is a mitochondrial DNA.
Hey, tell me, before you told me the story about the mother has a baby there, that sense can have some kind of proof about that kind of reality. You want to say the story?
Oh, okay.
Yeah, briefly.
Okay.
You're divine scientist.
First, I apologize to Hollywood. Maybe we violating some copyright. I'm not real Harry Potter. Okay. Well, do you know the ancient principle called as above, so below, as below, so above? It's universal. Yes, it's tantric, it's hermetic, it's everywhere. Also, like macrocosm and microcosm is a reflection of each other. This is a great Taoism principle. And I didn't realize, how does it actually work in life until I remembered one incident. In my childhood, I spent my summer in a remote village between Moscow and St. Petersburg. I'm from Russia. There was a neighboring village we went to visit some relatives, and we met this boy that has very strange birthmarks on his face. It appeared as if two hands overlapped the face, just like a imprint on the face. So we were really perplexed. I have a twin sister, by the way. So we come to my mother and say, what is it? Like, why is it so strange? This boy has these strange birthmarks. She said, oh, this is very rich story about it. So when he was not born yet, she said, his mother was walking down the main street in the village. It was evening time, and all the cattle was coming back from the field. And for some reason, there was a one big bull somehow getting off the leash and just chasing along the street and was running right into her. So naturally she got scared, and the only thing she could do is cover her face in fear. So I don't know how exactly she survived. Maybe somebody pulled her away, or the bull just didn't notice her, he just kept running. But when the baby was born, when she was pregnant, the baby was born, he had this birthmark exactly the same place as she was holding the hands. So at that time I took it as natural. But now I realize, wow, this is a great example of how we are all connected. How energy, vibration, all consciousness, all penetrates through our whole being, and we are a reflection of everything that happens inside and outside. So with that, I may just let you reflect on what you experienced today, and that even little things that we do, like breath, sound, hearing nature sounds, can have tremendous effect, on your health, on your mind, body, being. All right. And thank you for your attention. As we conclude, I would like to announce that actually tomorrow, Teacher Now is giving another workshop at Loyola Marymount University. It will be from 2 to 5 p.m. And if you want more details, there are flyers like this you can find at the exit. So please welcome, and good to have you today. Thank you for your attention. Doctor?
Thank you, all of you, for being here, for your attention, for your presence, for your participation. And we look forward to seeing you tomorrow. The conference starts at 9. We have the S. Vyasa, Dr. Nagendra's metabolic syndrome workshop, We have a lot of fantastic speakers, and I welcome you to more to come back, and thank all the speakers for today. Many thanks. Good evening.